Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth, so I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart, your host, and today we have part 2 in our series with Dr. Ben Miraglia. Ben, welcome.
Thank you, Hal. Thanks for having me. Happy to be here.
The first part was amazing. It was awesome. If you're listening to this one now, great, but go back and listen to part number 1 because this sets this all up. What we talked about in part number 1 was the importance of breathing, specifically the importance of nasal breathing versus breathing through your mouth. I tell my patients breathing through your mouth is like it's like an emergency exit in a movie theater. If there's a fire, you're glad it's there. You run out of it, but you don't use that door every day. Very rarely do you use it. That's what our mouth is for. Someone said we breathe through our nose, we eat through our mouth. We don't eat through our nose and breathe through our mouth. So just remember that, someone eating through their nose. So we talked about the importance of nasal breathing. Today in this broadcast, we want to talk about how nasal breathing or how mouth breathing affects sleep and how that can make our sleep less than optimal in quality and why that's important. So Ben, I'll let you take that topic and you can run with it and why nasal breathing and how it affects our sleep and why that's important.
Sure. Yeah. Thank you, Hal, for having me again for part 2. And so the short summary was that in round 1 or part 1, we built this pathway of underdeveloped jaws produce what is a poor airway or a smaller airway to breathe through. And when the nose can't do really well breathing or good breathing, what happens is the mouth starts to do some breathing. So underdeveloped jaws, well, we get that from the soft diet. So we'll back up and we'll say the early soft diet leads to underdeveloped jaws. The underdeveloped jaws compromise our airway. All of a sudden, we don't breathe through our nose very well, which means our mouth is going to do some breathing. Now, in the first part, we built mouth breathing as being wildly unhealthy for a human being, and we could even go a little further now with that. Mouth breathing during the day is unhealthy. Mouth breathing at night is even worse. So what we're getting at is mouth breathing doesn't help us get the air to our lung properly so the body can run beautifully. Well, the brain understands that mouth breathing is unhealthy. So when you lay down and you go to bed, chances are your lips are closed and you're breathing through your nose. But as your nose can't do the breathing and sustain it with beautiful airflow, the lips start to separate and now we start to breathe through our mouth. At that point, the body breathing through the mouth kind of wakes or activates a section of the brain to want to correct it. So if your brain knows that mouth breathing is unhealthy for you and is going to lead to, big trouble, then it wants to find a solution. So the reason the brain gets involved is this. We talked a little bit about how we have food, we have water, and we have oxygen or air. And with food, you could have 3 weeks without it, and you're going to be in big trouble. But then, with water, it's like 3 days, and air was like 3 minutes. So if you have poor breathing, what your brain can't distinguish is that, hey, is that poor breathing a little problem or a big problem? In other words, we could think about a big problem would be like choking. If you're choking, all of a sudden you would have a body response to try to fix that. Well, if you have poor airflow, it does activate the brain to want to fix it. So when your nose breathing is really poor and your mouth starts to breathe, all of a sudden the brain starts to focus on that, tries to improve the breathing. But if you're breathing poorly because your anatomy is deficient, meaning underdeveloped jaws, your brain can't fix that while you're sleeping. Now the difficulty is this. When we go to sleep at night, the brain has a primary function, which is to kind of clean and reset you for the next day. So what the brain does when you're sleeping is it basically takes everything that happened during the day and it files it away. So we accumulate during the day. I like to describe the show Hoarders. People know about hoarding. So when you're hoarding and you fill up your house, all of a sudden there's all this stuff in there. What are you going to do with it? Can you live that way or not? Well, basically through the 5 senses, the brain is a hoarder all day long. So all day long, you're collecting information. What do you see, what you taste, what you smell, what you touch, all the things from your senses get piled into your brain. Then, of course, you go to bed at night. Well, it's at night when you're nasal breathing properly. What the brain does is it works on all that information and it divides it and then it files it and it sets it up in all the file cabinets in your brain and it cleans it. So in the morning when you wake up, you're not in a hoarded position. So that's happening while you're breathing well. Turns out what happens when your poor breathing is going on, let's say mouth breathing or worse. Mouth breathing is bad, snoring is worse, obstructive sleep apnea is even worse than snoring. So what happens when your poor breathing is going on? Well, instead of the brain doing its job to like clean you, organize, file, set you up for the next day, like recharge you for the next day, it says, oh, well, the breathing isn't so well, I got to work on that. Turns out the brain can't do both at the same time. So what it does is it shuts off one and goes to the other. So now the brain's going to focus on, hey, I got to improve the breathing here for this person. If it spends its time at night trying to improve the breathing, we don't get the same refreshing, rejuvenated sleep we were supposed to get. Now, how do we measure this? Well, we measure it by what's called a sleep cycle. So when a human being goes to bed and they're breathing beautifully, they basically have a sleep cycle that they go through and it runs about a 90-minute cycle. So you have different stages you go. When it's drawn on paper, it looks like a staircase. You'd go in stage 1 and stage 2 and stage 3, and then there's a REM sleep section. So if you hit all the cycles appropriately, and then you repeat it a few times throughout your sleeping night, then what happens is you wake up refreshed. Well, it turns out that beautiful sleep cycle is only achievable if you're nasal breathing through the night. Mouth breathing or worse doesn't deliver that beautiful sleep cycle. What mouth breathing does is it fragments. We have this fancy word, sleep fragmentation. So all of a sudden, instead of having a perfectly restful, rejuvenated sleep cycle, night sleep, we're having this sleep fragmentation where the word arousal comes into play, which it doesn't mean that you're woken up necessarily. Sometimes people do wake up in the middle of the night, but otherwise there's activity where an arousal is an awakening out of a sleep cycle that's appropriately healthy. The mouth breathing person is sleeping and their brain is now focused on, hey, I have to improve the breathing because we don't get a whole lot of time without oxygen. So what the brain is trying to do is it sets up a mechanism to protect the sleeping person from getting to the point where oxygen is dropping. So oxygen dropping is very bad, the brain knows that, but poor breathing is like a precursor to oxygen dropping. So mouth breathing is the precursor to oxygen dropping. Well, the brain wants to work on that right away so we don't have an oxygen drop and have minutes to be in trouble. So what the brain does is it starts focusing on this, and by focusing on that, it stops the cleaning process and the organizing process. And next thing you know, you don't have a beautiful sleep cycle that delivers a rested, person ready for the day. All of a sudden you have a sleep fragmented cycle, which is broken and kind of destroyed, and you wake up during the day, you don't feel so good. Now you haven't had a restful night's sleep, you might talk about daytime fatigue or tiredness. Now, I know the words sleep fragmentation are tough for some people, so I'll go with sleep deprivation. Because a lot of people, especially new parents, know about sleep deprivation. So you come home with a new baby and you have to feed it and care for it every hour and a half. So how does that feel when you wake up every hour and a half to take care of a baby? Boy, you feel run down and drained. You don't feel as refreshed and ready for the day, the next day. And that can go for weeks or months for some parents. So think about sleep deprivation as the sleep fragmentation category. If you're mouth breathing at night and your brain has to focus on that to try to improve it, it's ruining your sleep. And ruining your sleep delivers someone who wakes up and hasn't been cleaned or refreshed. So in the morning, it's difficult to wake up and get going because all of a sudden your brain would recognize, hey, I didn't do my real job at night. I got to keep you sleeping to do my job. So what the brain tries to do is keep you asleep longer to get back to that job. That's why the morning can be a slow-going, sluggish start to the day. Then, of course, you have all of this imbalance going on. You haven't slept well. Somewhere in the middle of the day, the fatigue or the daytime tiredness sets in. So the difference really between the nose breathing and the mouth breathing when it comes to sleeping is that the nose breather has given the brain the opportunity to do its primary job, which is to clean, reset, file, basically put everything in its place and set it up perfectly so you wake up to a clean home. I like to use the hoarding analogy. You wake up to a clean home and you feel really good about all your rest. You're ready to attack the day. The mouth breather doesn't get to clean the house, that it collected all the information during the day, and now you're tripping over stuff trying to get your day going. So the hoarding analogy has worked well for me to describe the difference between what nose breathing does overnight and what mouth breathing does overnight.
Yeah, what does that do to your anxiety level, Ben?
Yes.
Someone that they're doing that every night, night in, night out.
Yeah, and that ties into where we're going to get to eventually, where there are relationships with other
Yeah.
diagnoses that we get that are symptoms and or struggles in categories like anxiety, depression, overweight, obesity, gastrointestinal or digestive issues. There's a whole host of things, including memory and cognitive ability. So there's a long list of things that are related to how well did I sleep? And there is a sizable amount of research showing that sleep deprivation and or fragmented style sleeping patterns deliver difficulties in pretty much every category and every system that a human being has to kind of function through during a daily basis. It can make the day a struggle for anyone.
Yeah, yeah.
Yeah.
And it all ties together. So last time we talked about small jaws, how that affects breathing, how that affects sleep. Today, Ben talked about how important sleep is and the importance of getting not necessarily quantity of sleep, but quality as well. Good amounts of quality sleep. Someone once said, well, I don't spend a lot of time with my child, but when I do, it's quality time. And I heard a child psychologist, it might be even a pastor, once said, children need large amounts of quality time.
Yeah.
And that's kind of what we need with sleep. No, we don't need large amounts, but there is an amount of sleep that we need, but it needs to be quality sleep.
Yeah.
And not all sleep is created equal.
Right.
So in our future series, as this continues on, we're going to look at some of the what poor sleep, some of the comorbidities that occur with that, or some of the symptoms that might occur with poor sleep. Was there anything else before we sign off here that you wanted to add about sleep? And
I'll add to the quality quantity that you just
Okay.
brought up. So in total agreement, that's a fabulous way to put it. And so when I think about quality and quantity, so there's no amount or quantity of sleep that can make up for poor sleep. So quantity becomes the second on the list. It's quality first, quantity second. And so when you have poor quality sleep, it won't matter how much you sleep.
Right.
It won't matter how much you nap. It won't matter if you get 12 hours of sleep every night. 12 bad hours is 12 bad hours. So the quality of the sleep is the most important category.
Yeah.
Then having the right amount, of course.
Right.
Once you have the quality in place, then if you were to get your 7, 8, or 9, whatever the recommended hours are for your age group, of course, children need more because they're growing. So if you had the correct quantity after the quality was in place, terrific. But the quality of sleep directly related to the breathing, you've got to get a nasal breather through the night where the nose breathing is smooth and clean and easy. And the way I like to describe that is, for parents, it's easy to understand the difference between good and bad breathing is silent and invisible. So if your lips are closed and you're breathing through your nose and that breathing is silent and invisible, that's a good sign. So if you were peeking in on your child and you can't see or hear them breathing, you're in good shape. But if you can see or hear them breathing, you're heading in the wrong direction.
Yeah.
Now, of course, if the mouth is open, totally, we're in the wrong direction.
Right.
But there are kids who have their lips sealed, but the parent can actually hear the breathing and see the breathing. Well, that's a struggle of breathing. What's coming next is the mouth's going to open. So it goes from, you have this range. Silent and invisible nose breathing is like the perfect thing to see. If you have nose breathing going on, but you could see or hear it, you've just started down the wrong pathway, because that directly will trigger the mouth breathing next.
Yeah.
So if you could set up the quality of the breathing and sleeping, you're well on your way. And that then with the quantity makes it right. There's no amount of quantity you can make up for bad breathing at night.
Yeah. For the parents out there, Dr. Boyd, who we referenced in the previous episode, talks about DQS, Dairy Queen Sunday. Dry, your child should be dry, no drooling at the mouth, no bedwetting. Quiet, this is while they're sleeping. Quiet, there's the cue, and still. So we don't want a child that's in 50 different positions throughout the night, and their sheets are a mess. So if you're seeing any of that with your kids, or your bed partner, if you're an adult, that's not good. We want it quiet, we want it dry, and we want still. It should be. I tell my patients it's like the Mississippi River. It's just kind of just smooth and along. It's not like a river up in the mountains.
Yeah.
Where you can hear it from a mile away. So if you can hear your child breathing or your bed partner breathing, that's an obstruction.
Yep.
that means there's something obstructing it. That's what snoring is. It's an obstruction, and that takes you out of your sleep cycles. And people that snore, first of all, they're breathing through their mouth. You can't snore if you're breathing through your nose. You'll start breathing through your mouth and then start snoring. That's an obstruction, and you're not getting quality sleep. So I think the point to take out of this is nasal breathing. Healthy nasal breathing leads to good sleep, and we need the proper amount of quality sleep. 6 hours of quality sleep is better than 9 hours of poor quality sleep. So I think that's a good point that you made there, Ben. It doesn't matter how much sleep you have, if it's poor quality. Doesn't matter.
That's right.
Just before we sign off, touch on, can you get quality sleep if you're taking a sleep aid?
Oh, so sleep aids exist, and there
Medications.
are medications, sleep aids.
Yeah.
So, that's a category where that type of treatment is coming towards the symptom, not the cause.
Right.
So if you're having difficulty sleeping well, and you feel like you have trouble falling asleep, you're waking during the night, you could end up on a pathway where, okay, it's time for a sleeping aid. Because if you're talking to your medical community about these things, look, I'm fatigued, I'm tired, I don't sleep well, there's a chance you might end up down a road of, okay, sleeping aid. We got to get better sleep, sleeping aid. Now, the sleeping aid, it acts like more like a sedative. So what happens there is you take this, and it may help you fall asleep faster. You may sleep through the night, but it's not quality.
Yeah.
Because the only thing that can deliver the quality is a nasal breathing pattern that has no resistant airflow. So that silent, invisible nose breather will have a quality night's sleep. If you take a sleeping aid, you still have a poor breathing pattern. You still have broken sleep cycles, but now you have kind of a little sedative on board. So it treats the symptom. And treating the symptom is different than treating the cause. So while you fall asleep a little quicker, you sleep through the night, you're not necessarily getting back to the healthy category.
Yeah.
So that is still an unhealthy patient to me.
Yeah.
It only treats the symptom. We try to avoid treating the symptom and focus on the cause rather than the symptom.
And I've always, I can't cite any medical literature with this, but I'm sure it's out there. But it's kind of like you have a computer in your car so when your car's not running efficiently, or maybe something's about to happen that's not good, your computer might shut the car down. Our brain, we fool our brain, and like you said earlier, your brain doesn't know if you're being choked or if you're snoring, or it just senses that something is wrong. I can't help but think sleep medications dull that sensory perception of the brain, and that could actually end up being dangerous, potentially, for somebody, because their brain's not doing what it's supposed to do to rescue that person from the lack of oxygen or the buildup of CO2.
Yeah,
So,
definitely, and that would be a cause for doing maybe different diagnostics to learn more about why.
Right.
What is the real reason we're not falling asleep well or
Right.
staying asleep through the night?
Right.
And when you pursue that route, then you could have a different list of things to do for treatment in the cause category.
Yeah,
And
exactly.
as opposed to just kind of tricking the body or fooling the body that it's fine.
Yeah.
And not addressing, well, why do you have it in the first place? Why don't we treat the cause?
Right.
Yeah.
And that's why Ben and I pursue more of what I would call a functional dental medicine philosophy, in that we want to get to the root of the problem and help our patients so they don't have to have CPAP, so they don't have to have medications, or because those are just treating symptoms. So part 3 coming up. We talked, of course, about why people are nasal breathing or mouth breathing, how that affects sleep. And now in our next few episodes, we're going to talk about some of the comorbidities or the bad things that that happen to us if we don't sleep well. And we always try to, there are solutions to this. So just stay tuned. We're educating you now. We'll get to the solutions later. So Ben, again, thank you so much. We'll see you next time. This has been Health in Harmony Beyond the Teeth. I'm Hal Stewart, your host. And I just want to say thank you for being with us and letting us share our knowledge and do something good for somebody today. Might be the only person that ever does anything good for them, and it might change their life. You never know. We're signing off now. See you next time.